Ashley, thank you very much. President Obama will keep on pushing for health care reform today, taking his traveling medicine show to a rally at the University of Maryland. And the battle lines have been drawn in the Senate after Finance Committee Chairman Max Baucus unveiled his 10-year, $856 billion health care package. It broadens eligibility for Medicaid, requires individuals and families to purchase insurance or face a penalty, and does not include the public option. But changes from the House are still yet to come. For more on that, I'm joined by Republican Congressman Michael Burgess of Texas. He's a doctor and chair of the Congressional Health Care Caucus. Good morning, Congressman.
Good morning. Good to be up early with you.
It's good to see you early in the morning. I'm curious, not a lot of people perhaps know as much about your background. I've read a lot about it. 3 decades in medicine. As a doctor, as a physician, what do you make of the senator's plan?
Well, of course, the senator's plan, we don't actually have legislative language yet, so it is a little difficult to pick through. Honestly, there's some things that I like. There's still plenty of stuff that I don't like. I actually think we're on the wrong track with this, and I particularly feel that way after August, after listening to constituents literally all over the country during August. People don't have a lot of faith in what Congress can do right now, and if we would pick 2 or 3 things that are really problematic in our healthcare system and work on trying to fix those, primarily some insurance reform, stop punishing people in the tax code, let people buy across state lines, I think we'd gain a lot of credibility on this. Right now, this is a tough uphill push, and now the president's going out. What bill is he going to be talking about? Is he talking about the bill that passed out of our committee, H.R. 3200, that I voted against, or is he going to be talking about the Baucus bill where we don't even have legislative language written down yet? So it's a tough job for him as well.
So, Congressman, you said that you have some likes and dislikes. Walk me through, what do you like about the current Senate finance bill, and what do you dislike?
Well, I like the fact that he didn't use the words public option together in a sentence, so that's encouraging to me. I do like some of the insurance reforms that he talks about. I think one of the things that really is concerning people is the problem with having a pre-existing condition and not being able to get insurance, to have insurance and play by the rules, and then find that your insurance coverage is pulled away, a so-called rescission, if someone gets a tough diagnosis. I think those are reasonable things. Mandate, in a free society, how do we justify under the Constitution requiring everyone to buy a product? And if you do that, then we've suddenly taken the burden off the insurance companies to create products that people like, and the price may go up. So I really do disagree with the concept of a mandate. I think there are ways to get increased coverage, universal access, as opposed to a universal requirement. Last year I was a surrogate on the main campaign for health care. I got to hear a lot about what now President Obama felt last fall. Mandates were not part of then Senator Obama's health care plan. Neither were the taxing on the employer insurance benefit, which we now see is emerging in the Baucus plan, and certainly of course the public option was part of the president's discussion last fall, and it's not there now. So,
Congressman, if I can interject, look, there's a lot of people who are angry about the costs. We're all not happy about what the costs could be, and they're astronomical. How do we afford health care change, health care reform, and drive down costs at the same time?
Well, Senator Baucus, to his credit, now has the lowest score from the Congressional Budget Office of any of the plans that have been put out there, and he pays for the increased spending that occurs into the Baucus plan is paid for by some pretty significant cuts in Medicare and other public programs, and the taxes and fines and levies and fees that are going to occur as a consequence of the plan. So the tax increases and the Medicare cuts primarily are going to pay for providing the benefit for the 25 million people that will be covered under the 25 new people who will be covered under the Baucus plan. Still leaves a lot of people not covered, and that's problematic as well.
As a physician, not as a congressman, take the congressman hat off, what are doctors concerned about? What do they feel about this bill or the other bills that are circulating around the House?
Well, Here's the deal. Medicine is not static, and I hear people all the time talk about how nothing has happened since 1993 when the Clinton plan failed, but that's not true. Things are vastly different in medicine today than they were 15, 16 years ago. But at the end of the day, the doctor has to see the patient in the treatment room and has to do his best or her best to render the care, and at some point they're going to have to collect something from someone to pay their bills and keep their office open and take a little something home to their families at the end of the day. That's not going to change. Those fundamentals are not going to change regardless of what plan or if no plan is passed. What concerns me is some of the promising things we've seen happen in the past couple of years. The way prices are held down with consumer-directed plans, giving people a little bit more control over their medical dollars, but making them active participants in their medical decisions. That's the direction I would like to see us go. We're going to have more involved patients in the future of medicine. The type of science that's going to be available to us, the type of technology that's going to be available to us. You've got to have informed consumers who actually have an interest in how their health care dollars are spent. Otherwise, we simply cannot afford to give everything to everyone all the time.
So, Congressman, I would assume, since this is something you've been working on for years as a member of Congress, and that's why you're the chair of the Healthcare Caucus, that you want reform. It's just the kind of reform you're seeing right now is not the kind of reform you support. Where does this thing end up?
Well, again, if we were listening to what people were telling us over the summer, we would have come back to Washington and hit the reset button, maybe the rewind or even the pause button, and looked at this thing a little more critically. If we took this, if rather than come up with another 1,000-page bill, if we came up with 7 things that we are going to fix over the next 3 years, bear in mind most of these benefits don't start right away. They start several years down the road. If we were to take that time frame and say, okay, first off we'll tackle pre-existing conditions and rescissions. Next we'll work on the tax code. Next we're going to work on the increasing the number of insurance products you have available to you in any state. President Obama correctly identified a problem during his speech the other night where some places of the country there's only 1 or 2 choices of insurance companies. Well, let's open up things a little more competition. There are things we can do without creating our own insurance company. There are things we could do to increase the amount of competition rather than decrease it. We could allow state reciprocity, state compacts. We could allow purchasing cooperatives and not cooperatives that dictate cost and prices to consumers and physicians. There are lots of things we can do. I'll tell you one of the things that's just really bone-chilling about the Baucus plan is this creation of this commission that is going to come to Congress with the Medicare cuts that need to be enacted, and then Congress either votes them up or down with no input. We will give an unelected, unaccountable panel the ability to enact draconian cuts in Medicare and Medicaid, and then just like the base realignment and closure commissions, all we do is get an up and down vote. But these aren't military bases we're voting on. This is going to be folks' personal health care that they receive under either Medicare or Medicaid or some of the other public programs, and they'll just come to us with a palette of cuts that have to be either voted up or down. That's a tough deal. As a physician, that scares me to death.
Congressman, you make a lot of excellent points. Pleasure seeing you this morning. We appreciate it.
Anytime. Glad to be with you.
All right. Well, we want to know what